Bronchiectasis is defined as permanent dilation of a bronchi and bronchioles. This is caused by destruction of smooth muscles and the supporting elastic tissue. So it's an irreversible dilation. Remember, permanent. But this time it affects mainly the bronchi and the bronchioles. You can compare that with what happens in emphysema, which is defined as permanent dilation of the airways distal to the terminal bronchioles. The destruction of smooth muscles and elastic tissue here typically is associated with necrotizing infections. So this disorder is not a primary disorder. Instead, this disorder is always related to a primary process such as persistent infection or obstruction. Bronchiectasis is defined as permanent dilation of a bronchi and bronchioles. This is caused by destruction of smooth muscles and the supporting elastic tissue. So it's an irreversible dilation. Remember, permanent. But this time it affects mainly the bronchi and the bronchioles. You can compare that with what happens in emphysema, which is defined as permanent dilation of the airways distal to the terminal bronchioles. The destruction of smooth muscles and elastic tissue here typically is associated with necrotizing infections. So this disorder is not a primary disorder. Instead, this disorder is always related to a primary process such as persistent infection or obstruction. Clinically, the characteristic symptom complex is dominated by cough and expectoration of copious amounts of purulent sputum. Purulent sputum usually contains white blood cells, cellular debris, dead tissue, and mucus. Purulent sputum is typically yellow or green in color and can be seen in cases of bronchiectasis and lung abscess. The diagnosis of bronchiectasis depends on an appropriate history and radiographic demonstration of the bronchial dilation. The development of bronchiectasis is based on two intertwined processes. The first is obstruction and the second is a chronic infection. Obstruction that is caused by foreign body, for example, impairs the clearance of secretions. So the secretions starts to accumulate, providing a favorable media for superimposed infection. So the secretions and the bronchial wall are infected now, and this induces an inflammatory reaction. The inflammation will result in tissue damage, especially to the bronchial wall, and also accumulation of exudate, which will further distend the airways, leading to irreversible dilation. Conversely, a persistent necrotizing infection in the bronchi or bronchioles may lead to poor clearance of the secretions. This is followed usually by obstruction due to the accumulation of secretions and inflammation with the bronchial wall damage resulting again in full-blown bronchiectasis. Clinically, bronchiectasis is characterized by severe persistent cough associated with expectoration of mucopurulent sputum. Other common symptoms include shortness of breath or dyspnea, rhinosinusitis, and hemoptysis. Symptoms often are episodic and induced by, for example, upper respiratory tract infections. Severe widespread bronchiectasis may lead to significant obstructive ventilatory defects. This can be associated with hypoxemia, hypercapnia, pulmonary hypertension, and cor pulmonale. However, with current treatment, outcomes have been improved, and severe complications of bronchiectasis such as brain abscesses or the cor pulmonale are less frequent.